Your child is growing up so quickly. Here are a few guidelines to make sure all goes well in this important stage of development.
At 2 years old, your child is continuing to explore her world, sometimes happily and sometimes with frustration. Her emotions may swing from happy to tantrums. Helping your child learn how to communicate her needs through language is important at this age. Most children this age are starting to combine 2 words into short phrases or sentences and can follow 2-step instructions.
Many factors can affect the health of children and families. Please let us know if you would like to discuss any issues related to your living situation, having enough food, drug or alcohol use in the family, or other things that are affecting your child or family.
Your child will be a little explorer at this age, so it is important to keep the environment safe by putting away fragile items, putting chemicals and medicines up high, making sure she cannot pull down tablecloths, and keeping cords and electrical outlets covered.
Now that your child is climbing more, make sure televisions and dressers are securely anchored to the wall. Do not put televisions on dressers. Always watch your child and be close by, and never leave your child alone. When your child is in the bathtub or near water, like a lake or swimming pool, an adult should be watching them and within arm's length of them so the adult can touch them at all times. Your child needs adult supervision whenever he is outside, especially around cars or near the street. Have the poison control phone number programmed on your phone so you can call poison control if your child swallows something that could be dangerous.
And remember to check your smoke and carbon monoxide detectors every 6 months to make sure they are working. Keep your hot water heater set below 120 degrees to decrease the risk of burns from hot water. Positive interactions with your child help their brain develop and build self-confidence.
When your child does something, says something, or looks at something, respond by naming things or encouraging them. Spend time with your child doing things like playing together, going on walks, or painting. Include some outdoor physical activities like walking or playing tag if you can. Your child will learn to solve problems by playing.
Protect against sun even on cloudy days by using a sunscreen with sun protector factor, SPF, of 30 to 50. For insect repellent, use one with no more than 30% DEET and apply it only to the outside of your child's clothes and to exposed skin. Also have your child wear a hat with an all-around 3-inch brim, keep your child in the shade when possible, and offer plenty of water when enjoying the outdoors.
Include your child in daily routines, explaining what you are doing or what is happening around you.
Let him put an arm into a shirt sleeve and feet into shoes. When reading daily with your child, ask him questions about the pictures in the book and let your child touch and handle the book. You can also let your child make up some of the story or repeat it to you. Children's brains will develop more by playing with safe toys like blocks and looking at books with you than watching TV or playing with phones and tablets.
If you do decide to introduce screens at this age, we recommend you watch with your child programs or applications that are educational and less than 1 hour a day.
When your child is 2 years old or older, you can use a forward-facing car seat, but it is safer to continue with the rear-facing position if your child has not reached the weight or height limit for the rear-facing position of the car seat. Check your car seat's instructions. The car seat should be in the back seat. Never leave your child alone in the car.
Since your child is actively exploring her environment, it is important to develop good hygiene routines, like washing hands frequently, using a tissue, and coughing into their own arm to prevent the spread of germs during an illness. Separation anxiety and stranger anxiety are normal at this age. It is best to reassure and not force them to go with others, even if it is with a family member. You may notice temper tantrums and increased conflict with your child. For behavior issues, consistency and setting limits are important. Encouraging your child with praise for good behavior helps improve behavior and also supports self-esteem. When your child is behaving well, give them positive reinforcement, such as by giving them a loving pat on the back or telling them they are being good or helpful. If you have to stop your child from doing something, a firm but calm no is the best way to communicate to your child to stop. Allow them to pick from 2 options acceptable to you to avoid or resolve conflicts. Use words to help your child identify feelings like happiness, anger, and frustration. Spanking for discipline is not recommended because it can hurt the child and it teaches them to hit. If your child is upset or out of control, sitting with or holding the child until everyone is calmer can be helpful. The child is never bad or wrong, just the behavior. It is important to stay calm if you have to discipline your child and always let them know you love them. Children at this age can still choke on small, hard, or slippery foods, so stay away from small foods that can choke them, like grapes, raisins, or peanuts. Your child should drink 2% milk, but no more than 16 ounces per day, and should also drink water rather than juice to prevent the risk of cavities and excess weight gain. Remember, your child should be off the bottle by this age and only using a cup. Offer your child a wide variety of healthy foods, including fruits, vegetables, and protein with each meal. Half of your child's food should be vegetables and fruits. A serving size is the size of your child's fist, so do not serve large portions. Having regular family meals without screens and 2 to 3 small, healthy snacks will help your child learn to regulate his food behaviors. Do not force him to eat or bribe him, as this may lead to more food resistance. You may notice more picky eating behaviors at this age. Things that can help with this include eating together as a family, so they can see what you eat, offering varied food choices, and allowing your child to self-feed. Do not force feed, as this will likely make them reject food further. You provide healthy food choices on the plate and decide when they eat, and let your child choose which items on the plate they will eat and how much. It's okay if they don't eat much during a meal. You may save it and offer it again when they are hungry. Do not use foods as a reward or replace a meal with sweets, snacks, or milk.
Your child should see a dentist at least every 6 months. Brush your child's teeth twice daily with a small smear of fluoridated toothpaste. He may want to do it himself, but you should continue to help. Except for water, no eating or drinking after the nighttime brush. If possible, start weaning your child off the pacifier, as prolonged use may affect his teeth and speech. Consider limiting its use to only bedtime or naps. Your child will probably start toilet training between 2 and 3 years old, but many children are not toilet trained before 3 years old or do not have complete daytime dryness until 4 years old. You can start to prepare your child for toilet training by reading books about it. Get a potty or potty seat and get clothes your child can easily pull up and down. Watch for signs that your child is ready to toilet train, such as your child staying dry for 2 hours, letting you know they have a wet or dirty diaper, and can pull their pants up and down. It is best to wait until your child shows they are interested in learning to use the toilet. Pressuring or punishing your child may make them more resistant. When your child is ready, have them sit on the toilet every 1 to 2 hours, especially 15 to 45 minutes after a meal or drinking. Praise or reward your child for sitting on the toilet. Teach your child to wash their hands after sitting on the toilet. If your child gets a rectal temperature of 102.2 degrees Fahrenheit or greater, she needs to be seen by a healthcare provider. To check the temperature, a rectal temperature is the most accurate, but at this age, you can also take the temperature with a forehead, temporal, or an ear thermometer. Do not check the temperature in the mouth at this age.
It is okay to give your baby Tylenol, also called acetaminophen, Motrin, or Advil, also called ibuprofen, for fever or pain, but it is best to seek medical care first if the temperature is 102.2 degrees or higher. Use the emergency room for emergencies, but call us first if your baby is sick but not having an emergency.
If you have any questions, please ask your healthcare provider. Your child is entering an amazing stage in their lives. They grow up so fast.